Coming up next, we'll talk about the research behind calculus, the importance of biofilm, and the special properties of calculus that you may not be aware of. So this is the distal aspect of tooth number 30. How does tooth number 30 look to you? Does that distal, you see the distal pocket right here, you see that? But how does that look to you? Pretty clean, huh? Well, if we look, you see that in fact there is some bone loss in that area. If we went down with an endoscope, you see this yellow triangular point. This is calculus. Below the gum line, you can't see it on the x-ray, but boy, can you see it on the scope. And the calculus itself is an irritant, and the calculus will cause continuing bone loss. And by the way, my hygienist, who was looking at that, when she was feeling it before she looked at the scope, the words that she said to me, she said, I thought this was clean. And you would think so too, looking at the radiograph. So there's the calculus. We'll talk more about that calculus in a few minutes. So does smooth equal clean? And the answer is no. Some people have more tactile sensation than others, but I'm going to show you that even if you have the best tactile sensation, it's still not enough. So we weren't failing. We were blind. The fact is we're depending on feel when in fact you can see what happens when you see. It is visibility that makes all the difference. And so if our limitation is 4 millimeters or less than 4 millimeters, the camera allows us to see the root surface and allows our hygienists to do actually what we want them to do, get complete root cleanliness. Is it biofilm? Because we're hearing an awful lot of that. There was a study done by Tom Wilson and Steve Harrell, two of my colleagues. They're both in Texas. And they used the endoscope that was available at that time in November 2008. And they looked below the gum line. And what they looked at was inflammation of the pocket lining against these three areas. Number one was no calculus or biofilm. How much inflammation they have there? Biofilm alone with no calculus, how much inflammation was there? And calculus also covered with biofilm. How much was there? No calculus, no biofilm. You wouldn't expect very much inflammation, less than 10%. Biofilm alone, about 25%. 25% of the pockets against biofilm alone were inflamed. What does that mean? The other 75% were not. But if calculus was involved, over 60% was inflamed. I'm not saying the biofilm isn't important. It is. But based on this study, and this study has not been refuted to my knowledge, calculus is more important. And removal of calculus is important in order to be able to reduce that inflammation. And certainly that's been in our practice, and we've had that going for that long period of time, for the 26 years. So it is calculus removal that is number one. Biofilm, by the way, initiates the lesion. There's no question about that. And biofilm will inflame 25% of the areas, but it's the calculus that is really more responsible for that. And biofilm does not equal calculus. In this study, again, done by Steve Harrell and Charlie Cobb, I was part of the study as well. How do you like that? Calculus is a risk factor for periodontal disease. And what we found was that during osseous surgery, there are concavities in the root surface, and due to the anatomy of the root, the calculus would be very difficult to remove. In fact, this was shown with a video scope. This was a scope that was used for surgery in order to be able to help Steve Harrell, in particular, look at root surface. And Steve developed the video scope for surgery many years ago. So you do the best you can, hygienists do the best they can, and this is what you see. So the calculus remains. And now that we know how important calculus is for inflammation, then we can move forward from there, because that is the premise that we're using, that I'm using, that I'm proposing is important. So we know the calculus itself can harbor bacteria. But the question is that the only story? And the answer is, I wouldn't be asking the question, would I, if it was the only story? The answer is no. Calculus itself is an irritant. Okay, it's not biologically neutral. And so calculus itself will initiate the inflammatory response even without biofilm, and it'll perpetuate the inflammatory response. A number of studies were done showing what calculus does. This is looking at sterile calculus. And we look at sterile calculus, and it begins the immune response called the NLRP inflammasome reaction. Essentially, it's a switch. and the switch is flipped, the body says, I don't want that, and the body starts to get rid of the tooth through IL-1 beta, which stimulates osteoclast, which causes bone loss. 4 separate studies have shown that. So now this makes a lot more sense. If you got calculus that's there, even though it's smooth, it's still there. You can't detect it. It's not removed. Disease continues. Is there any reason why you go in, you check your hygienist, and the patient is still bleeding? The reason it's still bleeding is because your hygienist can't see the calculus, can't get it out, and the disease continues. Coming up next, we'll talk about a property that you may have never heard of before: fractured calculus.